2, 1. Please start, sir. We are live.
Good afternoon, everyone. On behalf of NEST 24 by 7, I welcome you to our public awareness program on Thresh the Nest. NEST 24 by 7 aspires to the bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To speak on Thresh the Nest, today we have a renowned gastroenterologist, Dr. Gaurav Tambodia sir from Ahmedabad. He needs no introduction. However, I would fail my duty if I don't mention that he is a leading gastroenterologist in Ahmedabad, providing comprehensive care to many patients for various gastrointestinal and liver conditions. He has over a decade of experience building a clinical skill set that allows him to deliver patient-centric care. He is currently a consultant gastroenterologist at Divine Gastro and Liver Hospital, Ahmedabad. We salute his dedication towards spreading awareness related to liver health and disease. So now I invite Dr. Gautam sir to enlighten us on the topic. Over to you, sir.
Yes, thank you very much for your brief introduction. I am Dr. Gautam Tambolia. I am a consultant gastroenterologist from Divine Gastro and Liver Hospital, Sabarmati, Ahmedabad. So today I will be discussing one topic that is very common nowadays, that is non-alcoholic fatty liver disease. Okay, it is very common, as we are aware that it is found in all imaging, blood test, even incidentally. So I will brief you regarding some slide that I will discuss with you. So starting with the liver. We know that it is the largest organ of human body, and it is football. So it is the metabolic headquarter of the body, and it absorbs all extra sugar and store fat it as a future. So coming to the point, what we are going to discuss today, we will discuss non-alcoholic fatty liver disease. So what is non-alcoholic fatty liver disease? We need to understand that it is a condition in which liver makes in which the fat makes up to more than 5% of weight of the liver. Okay, and it is not caused by some other factors like secondary causes of non-alcoholic fatty liver disease like drug, viral infection, and also you have to rule out the history of alcohol. So it is the extra deposition of fat in the liver in the absence of secondary causes like alcohol and other secondary factors like drug and viral infection. It is very silent killer disease. If we left untreated, it progresses into the severe NASH and ultimately into the cirrhosis and hepatocellular carcinoma, liver cancer. There are some risk factors behind non-alcoholic fatty liver disease, that is patient is overweight, or patient is obese, or patient is having history of dyslipidemia, or patient is diabetic. So why we are discussing this? Because if we treat this disease, we can treat a very common cancer, that is liver cancer. But if we will not treat that, it is progress into the severe NASH that is non-reversible. So what is NASH? It is a non-alcoholic steatohepatitis. So along with inflammation, if there is a fibrosis scarring in the liver, it is called non-alcoholic steatohepatitis, and a very serious form of the non-alcoholic fatty liver disease, which may progress into the liver cirrhosis and liver cancer. So there is a spectrum of liver disease. When somebody is having fatty liver with risk like factor like diabetes, cholesterol, and obesity, it progresses into the non-alcoholic fatty liver where there is inflammation in the liver. And when it progresses into the fibrosis form, where liver gets scarred and there is fibrosis formation, which occur over a period of time when you does not treat this comorbidities like obesity, dyslipidemia, or diabetes type 2. This non-alcoholic fatty liver takes the serious form of the spectrum, that is non-alcoholic steatohepatitis. And if it is left untreated over a period of 5 to 10 years, it may progress into the cirrhosis and liver cancer. So what is the liver prevalence of the disease? So if you see overall global surveillance, that every fourth patient, 4 out of 1 patient is having fatty liver. And if you see in a diabetic, every second patient is having fatty liver in case of diabetes. And if you see in obese, it is almost common in every obese patient. Means all obese, half of the diabetic, and 1/4 of the general population. So it is very common, and its prevalence in India is almost 30 to 35%. So what are the causes that I have already discussed? The risk factor, and uh, now my point is why we are discussing this alcoholic, non-alcoholic fatty liver. Why? Because we have to diagnose this disease very early. So there are some diagnostic tools. Most of the time, people came with report of blood report that is high SGPT. People usually come with ultrasonography report showing fatty liver grade 1, 2, 3, and we need to do liver biopsy in some cases where it is progressed to the NASH form. But nowadays, a good diagnostic tool that is the FibroScan, that is very commonly used nowadays and readily available, very comfortable. We can use it repeatedly, and it gives non-invasive form of liver biopsy. So FibroScan interprets the non-alcoholic fatty liver progression in the form of fibrosis and cirrhosis. So it measures the it measures the liver stiffness in kilopascal value. If somebody is having 2.5 to 7.5 of liver stiffness, then it is mild fibrosis. And if somebody is having 7.5 to 12.5, then it patient is having a severe form of fibrosis. And if it is more than 12.5 kilopascal, then it is a cirrhosis, NASH cirrhosis. That is irreversible condition and very life-threatening, silent killer. We have to treat this disease. Otherwise, patient is landed in the serious form of liver failure. So FibroScan we do routinely in our OPD. I have FibroScan machine. I do routinely, and I pick up the this serious form of NASH very well in this patient. And people usually get treated with this pharmacotherapy and lifestyle modification, and we can survive the patient and we can reverse the disease. So what to do for treatment in patient of non-alcoholic fatty liver? Only recommended treatment is lifestyle modification. Along with that, you can give pharmacotherapy like drug treatment in those in whom the pharmacotherapy means lifestyle modification not work properly. And even we have option of surgery, but currently there is no proper recommendation for surgery nowadays. But at least along with lifestyle modification and pharmacotherapy, we can reverse the disease. So for diet, we have to take hypocaloric diet, calorie diet. We have to take low calorie, low fat food. And for diet, for exercise, we have to exercise regularly. Aerobic exercise is recommended. If you walk 30 minutes in a daily, brisk walk daily, then it is almost more than enough. At least 150 minutes per day for at least fatty liver, you will reverse your fatty liver or even non-alcoholic steatohepatitis. Now, if some patient come with complaint that I cannot walk, I have spine problem, means obesity get worsened when I stop walking, and there are many reasons patient cannot modify their lifestyle. So we add pharmacotherapy like drug that are the basically drug that reverse the fat inflammation and fibrosis. So for that we have vitamin E like drug E drug that reverse the inflammation and fibrosis in patient. We have insulin sensitizers like pioglitazone that helps in diabetic patient. Even we have newer drug like GLP-1 agonist, that is semaglutine, and obeticholic like drug. But and the newer drug that is saraglitazar, that is we common in now very famous with name of Bilypsia. That is very commonly used drug nowadays in patient of non-alcoholic fatty liver disease, specifically those who have diabetes. So those patients with NASH with diabetes, saraglitazar work very well, and it reverses the fibrosis also. and it a very beneficial drug in patient with non-alcoholic fatty liver disease. We does not recommend bariatric surgery routinely in patient with non-alcoholic fatty liver disease, but if yes, if apart from surgical bariatric surgery, if we can offer treatment of endoscopic bariatric surgery like balloon placement, this is very helpful in patient of morbid obese or those who cannot perform, we cannot go ahead with surgery in this patient. So thanks a lot, this Zydus people for giving me opportunity for to give talk on this non-alcoholic fatty liver disease. It is very important topic. We should aware, and everybody should aware about this problem, so we can save the a community that is having trouble with this. Thanks a lot.
Thank you, sir, for this wonderful talk. This has really enlightened us. Now we will take questions from our audience with your permission.
Yeah.
Sir, one question is there in chat box. Who is at most risk of NASH?
Yeah, I have discussed these three parameters, that is obese, dyslipidemic patient, and diabetic patient.
Okay. Sir, next question is, what if I am diabetic and get diagnosed with fatty liver?
See, we have to see the blood test, that is SGPT. If it is yes, higher side, then it shows inflammation in liver, and we have to go for FibroScan, that is very routinely used nowadays. And if there is fibrosis, then we have to modify the lifestyle, diet style. Along with that, we have to supplement with some pharmacotherapeutic agent, that is saroglitazole. It is very commonly used drug in patient with NASH with diabetes, and it gives wonderful result.
Thank you so much, sir, for your valuable insight. Sir, one more question is there. How long medicines for fatty liver continue?
This is a topic for question. I think it depends how patient respond. Sometimes we have to give 3 months, 6-month therapy, but we have to see the side effect also. If the side effects are on the higher side, then we have to it considered as a double-edged sword. So we have to we have to think about that also.
Sir, one more query is there in chat box. Is NASH hereditary?
See, NASH is basically its risk factor are diabetic, dyslipidemic, and obese patient. So yes, hereditary risk factor are there. So yes, hereditary, but it is not if somebody is in family is having NASH, then the subsequent generation will have. If you have good lifestyle and diet style, if you have good BMI, then definitely you will not have this problem in your future.
Sir, questions are over. No more questions are in chat box. On behalf of NASH 24/7, I thank Dr. Gautam sir for this lively and informative talk. As you have been emphasizing the awareness for the liver health and disease, it is also important for people affected by fatty liver to regularly visit the doctor and continue medications. With careful observation of precautions, it is possible to obtain control of the disease. I would also like to thank our audience for their active participation and patience in making this event successful. You may also share your suggestions so we can address them in our upcoming FB Live programs. Stay connected with NASH 24/7 on Facebook and take care of yourself and your family members. Thank you.
Welcome.